combat the opioid epidemic in the Tennessee Valley, doctors and first responders have had to take some different approaches. News's Robin Estabrook explains in this special report.
Emergency responders in Hamilton County are seeing the effects of the opioid epidemic firsthand.
And it's deadly, it's killing people, and it's something we're trying to counteract.
First responders are now equipped with Narcan to help reverse overdoses.
By giving the Narcan, we're effectively continuing the breathing process, which lets the patient survive the effect of that narcotic.
Director of Emergency Medical Services in Hamilton County, Ken Wilkerson, says it doesn't have any negative effect on the patient.
There's no getting sick. It basically puts the patient into an effect of where they're no longer under the effect of that narcotic. The worst thing that happens in those situations is they may go through a withdrawal.
Dr. John Blake, who specializes in pain management, says prescribing certain painkillers depends on the nature of the injury.
Or what the nature of the pain is. You first have to decide whether this is an acute or a chronic problem. Most of the time, acute injuries are fairly easy to figure out why they're having their symptoms. And a lot of what you see is acute postoperative pain or acute traumatic pain, and that's fairly easy to figure out how they're hurting, and you just have to treat that as best you can. Opioids are commonly used for that, but there also are a lot of other medications such as anti-inflammatories that can be very effective for that.
Dr. Blake says the opioid problem has made them prescribe more cautiously.
I think as a medical community, we are making a lot of changes in how we think about opioids and their risk of abuse and addiction. Well, I know there have been lots of different changes in the way the medical community has changed how we write opioids, how much of them we write, what we do before and after we write an opioid.
He wants to acknowledge there are people who use the medication appropriately.
You know, I think we do need to be aware of the prescription opioid epidemic that we have in our state and in our nation, but I also do think it's important that we realize that, you know, there are a lot of chronic pain patients that do take chronic opioids that are not drug addicts, that take these medications because they improve their ability to function, their ability to go to work and live relatively normal lives.
In Chattanooga, Robin Estabrook, News 12 Now.
Now, Hamilton County's EMS director says they probably respond to about 8 to 10 overdoses a week.